First, I'll provide a quick overview of Detroit products. We're a 21-year-old company with about 450 employees in 6 global locations headquartered in Troy, Michigan. We specialize in engineering services, advanced design and simulation, reverse engineering. DEP is best known for our engine ion sensors and Meshworks engineering software. Meshworks is an engineering software platform for morphing CAD and CAE data to new variants and also providing world-class meshing. The engine ion sensor is a specialty product that provides a window into many engine performance parameters in real time and contributes to better fuel economy, reduced emissions, and it enables multiple fuel types to be used on the fly. DEP supports all major industries and takes on many co-development roles, including the ability to take full responsibility for product development, validation, testing, and prototype delivery. Our engineering team, in partnership with our Meshworks software, ensure our clients' products better meet performance standards. We support commercial projects, defense-related projects, and we partner with research universities and national labs. We can take full responsibility for complete product development and innovation, from design to validation and prototype delivery. DEP has completed over 900 projects for our clients, and we're especially proud of our current endeavors. DEP is going to provide a snapshot of the past 5 or 6 weeks and how we reacted and adapted to the sudden health climate change. There have only been a handful of events in the past 100 years where nearly the entire global population has felt the effects of a single event. The COVID-19 pandemic will definitely be discussed for decades, and we still don't know its exact course and resolution. During these unprecedented times, challenges can lead to opportunities, and opportunities can embrace innovation. Today, we'll discuss processes that businesses can explore to see how they may fit into new supply chains or create new ones, how flexibility can lead to opportunity, and what partnerships may need to be forged to be part of the solution. We're pleased to provide our perspective of how we utilized our 21 years of engineering experience as a company and our personal experiences to innovate, reduce product development time, open new supply chains, and secure new partnerships. In times like this, we all want to be part of the solution. This includes everything from social distancing, which I'm pretty sure is going to be the phrase of the year, if not the decade, and also practicing good hygiene and hand washing. We'll have to embrace new fashion statements such as face masks, gloves, glasses, eye goggles, raincoats, scarves, and balaclavas. A few months ago, we'd stare at such attire and wonder if this was an overreaction. Today, not dressing that way will draw scorn and even denial for entrance into some buildings. Much of the world has found out we were unprepared or underprepared. The next question, how are we going to react? I'm sure many people on this call have been involved in some capacity with product development. Even new projects still have a good deal of familiarity, and you can rely on personal experience. These projects are usually about additional functionality, cost reduction, or better meeting performance criteria. But some projects start to enter uncharted territory. Even in these cases, there's usually a considerable amount of time available to navigate the unknown, and you can move through the process in measured steps. But what do you do when you find yourself in a situation where there is a bigger picture, and your products are secondary, or perhaps not even in the realm of being useful during a crisis? A lot of small and medium-sized businesses found themselves in this position. Even the largest OEMs may have found themselves labeled as non-essential. What do you do then? Do you sit and wait? Do you knock on more doors that likely won't open? Or do you ask, how can you be part of the solution and identify the opportunity in the chaos? As the shift towards social distancing and working from home cemented itself, DEP was already prepared with 90% of our workforce already transitioned to an online schedule. Being a global company with employees, customers, vendors, and business partners in dozens of countries, we had long ago grown accustomed to carrying out business and engineering activities online. We were fortunate. At the onset of this pandemic locally, we organized our company to continue to support our clients with essential business projects, and we ensured our ongoing support. But we also set up a DEP team to research, explore, and learn more about what the new market needs seemed to be as the COVID crisis unfolded. And we reported our findings back to a newly organized internal committee. We identified several needs. Most were obvious, but we also tasked ourselves with brainstorming to see what may be missing. We put all of our ideas on the table even before we discussed capability, capacity, business opportunity, or even FDA approvals. We then spent a full day educating ourselves using every piece of online data, YouTube videos, browsing through websites, and better understanding various price points. We then assembled a listing of our current supply chain and partners, including those involved in machining, tooling, fabrication, injection molding, stamping, 3D printing, cutting, welding, and assembly. We also researched online inventories to assess our bill of material needs. The next step was to assess the needs of the medical community, first responders, and all those that were short on a variety of personal protection products. We drew up our first draft and statements of work to be part of the solution. Many of our engineering team moved to a voluntary 7-day work week. As it turned out, they all had family and friends in healthcare or working the front lines, and this project became personal. Something unique that we experienced was the social distancing requirements, especially during prototype creation. If there was one lighthearted moment during this time, it was having multiple engineers trading ownership of a limited space during prototype assembly while keeping 6 feet away from each other. I'm told it was a dance never before seen, and I can imagine the frustration and patience involved. In parallel to this process, we listened to the news, we read the papers, we visited state and federal government sites, we researched product standards, and most importantly, we engaged with leaders at the county and state level. I am proud to say that in Michigan, I believe we were quick to organize. This was definitely a time when information was important. Good decisions can only come from good information. We found that county and state officials were fairly well organized. We were made aware of a variety of agencies and clusters that were quickly established to figure out how we could retool, rethink, and better define a path towards production. We all had to figure out how we could achieve high quantity output in weeks, not months or years. With that, we finalized our plan and kicked off. DEP decided to focus on face shields first, which was a readily available existing product in the healthcare market up until recently. Secondly, we focused on an aerosol blocker, which was basically a clear plastic shield that would fit over patients on their beds with the hope of reducing potentially dangerous aerosol spray in the air. This type of product had a few prototypes floating around the market, and we thought it could be a good new solution to mitigate contagious transmission of aerosol vapor, but it was not yet a product that was embraced throughout the market. The third product we chose is because DEP has a long history working on complicated airflow and fluid flow products, including a variety of engines. So we decided to evaluate how quickly we would create non-invasive ventilator prototypes using mostly off-the-shelf parts for a cost-effective product. And finally, we partnered with our suppliers to create a variety of designs for gowns that could quickly be cut in multiple layers with a single shot. So we chose our 4 products for the time being, and now questions had to be answered. What were the FDA stipulations? How did they apply? What are the material types required, and what flexibility did we have? What are the volume and quantity capacities required? What is the availability of off-the-shelf parts and components? What consultants may be available? Who can help with specialty component creation and 3D printing? What financial investment is required? What partners may play a role in cost mitigation and cost sharing? We knew that each investment that we made could make it more difficult to continue our internal staffing levels, so we had to be responsible during this investment spending. Over the course of about 48 hours, we answered almost all of those questions, and we reorganized our team. I won't go into too much detail regarding the inner workings of each product, but I'll just provide a brief overview. I can share that each product evolved, sometimes on an hourly basis, as a result of feedback from the medical community and our continued research. With most product development projects, you have to meet standards for safety, human factors, durability, etc. For products or devices in medical or contagion settings, FDA approval is almost always required. The FDA invoked many special short-term clauses to ensure as many products as possible that were found to be safe and effective could enter the supply chain without a specific approval. But there were still rules that had to be followed. Certain labeling was required, and claims made regarding product capability had to be very narrow. With this in mind, DEP set out to ensure we could later take our products down the path of FDA approval. But we also measured in ensuring we could go to market with requirements that didn't exceed 2 or 3 weeks. We invoked a lot of original thought during our execution, so we believe we found a way to stay clear of patent infringements or intellectual property issues as well. One of the good things to come out of the recent events has been the open technology environment. I think if you haven't already, you'll hear a lot of stories of many businesses sharing how to take needed products to production without worrying at this time about patent infringement. It's been really nice to see that cooperation. As I mentioned, DEP's first finalized design was the face shield. It was a simple curved clear plastic, had a foam heading and elastic band. Over the next several days, we went to complete 4 design variants, each offering an additional benefit. Our latest design allowed for the face shield to pivot up and down, which we found out was important for the wearer to get a few breaths of clean air, to better read computer screens, and to mitigate contamination possibilities by not having to remove the entire face shield and then put it back on again. We also modified the design to allow the see-through plastic to be easily replaced and the frame to be sanitized in a reusable fashion, which helped to reduce long-term costs. We also followed FDA guidelines regarding shield wraparound, offering varying sizes, and opting for non-latex materials in the elastic band. Additional design feedback was provided by our production suppliers to try and reduce costs, increase production capability, and make assembly quicker. The biggest challenges we faced for the face shield was material shortages for the clear plastic. There was a near zero supply, and estimates for stock replenishment was about 2 to 3 weeks. After a few days, the material suppliers seemed to put in a lot of extra hours, and the lead time to plastic material being available was reduced to about 1 week. Product number 2, our aerosol blocker, came during our research session. We saw what looked like simple acrylic boxes in the prototype models covering patients like they were in a mini greenhouse with an opening at their chest and it holes in the side panels for access to the patient for tubes or hands. We thought of a number of potential hazards with a box-like structure and difficulties regarding dangerous sharp corners, difficulty for stacking, storing, and transportation as well. And having panels that attached at right angles also made it more difficult to clean and disinfect easily. We also questioned the long-term durability if they became unglued. So DEP designed a molded model without sharp corners, easily accessible to clean and disinfect, stackable, and durable. We've just shared this product with the medical community this week, and I hope to have feedback soon. Product number 3 is our ventilator. I can tell you that there is much more to ventilators than just air being pumped into patients. Thanks to YouTube, I spent several hours in mini training sessions on the various operational modes of the more advanced ventilators and the calculations and controls built in to give those patients in the most dire circumstances a better chance for survival. We learned about invasive versus non-invasive, air volumes, breaths per minute, patient-assisted breathing, min and max inhalation and exhalation levels, oxygen saturation, controlling the speed at which air is expelled, how long exhalation should last based on certain breathing difficulties and underlying conditions, how to better activate the alveoli inside the lungs, and what you shouldn't do during ventilation that may cause them to retract and work less effectively. Plus a half dozen other operational modes that could be required on the fly based on the needs of the patient and the complexity of their ventilation requirements. So we asked ourselves, what can we do in 7 to 10 days to provide practical capability in a prototype model that might fill a void and ensure we could still go to production in 2 to 3 weeks? So we asked the experts, and thanks to our participation in many newly created webinars hosted by the state of Michigan and its affiliates, we found that invasive ventilators where intubation occurs will also generally require the ability to vacuum material out of the windpipe. This was another layer of product capability and design difficulty that we thought could put us off by months. So remember that just 6 weeks ago, at the time this all started, science and data models were just telling us that ventilator shortages could become a massive issue, not only in Michigan, but across the U.S. and across the world. Most likely continuing to also affect many other countries 1 to 2 months down the line when their peaks on the critical patient list would measure out. So we asked a simple question. What benefit could a non-invasive ventilator with the ability to control inhalations per minute, volume of air, and oxygen levels provide? Is there a market for such a device for those patients that are between the not needing breathing assistance and those that need the more advanced ventilators? We also asked how many patients are improving and leaving a critical breathing situation that may only require non-invasive ventilation breathing support to ensure proper oxygenation. We were happy to find out from the medical professionals that up to 40% of patients fit the DEP ventilator category. That right there told us our solution could increase the availability of the advanced ventilators by 40% and better ensure the most critically in need had access to the medical technology best suited for their condition. Throughout the process of the helpful Q&A sessions with hospital personnel, we made progress assembling a functional prototype. It turned out our greatest challenge was securing bellows. That's the accordion-like structures that compress and provide the airflow. It turns out there was a run on the market for bellows by many companies trying their hand in developing ventilators, as well as current ventilator manufacturers buying up the entire supply chain. For several days, we couldn't find one anywhere on any website, but then production started to catch up with demand, and we found our bellow. DEP is working on our commercial prototype as we speak, and we're planning on hospital trials in the next 3 to 5 days. The fact is, the COVID virus will be reaching peak levels throughout the U.S. and in more countries in the next weeks and months. There will continue to be a potential for hotspots. We also do not know if the reopening of businesses and protective plans can ensure there will not be another large outbreak. For these reasons, we're working hard to bring production capacity forward for this life-saving device, and we'll learn more in the coming days. The final product we'll cover today is gowns. They are in strong demand with a variety of material types. There are companies that specialize in woven material or a more traditional cloth gown, so we're partnering with our production suppliers to make both semi-permeable and non-permeable plastic gowns. Our first prototypes will be sent to local hospitals later this week for review and feedback. So what did we learn the past month? Speed is of the essence. In these unprecedented times, it's important to move quickly because the window to not miss out on an opportunity can literally be hours to a few days. Transparency is important. Tell your potential suppliers or potential new vendor partners exactly what you expect out of them and have them commit to whatever they are comfortable. Even if you don't like what you hear or don't like their pricing, you may not have a choice. It's important to exercise restraint because you don't know who you may really need. Make the partnership rewarding for both parties. Let everyone experience the smiles when delivering donated items and include all participant names on the packaging. Share the pictures and the credit online. Get the word out. Tell people what you need and why you need it. Goodwill and help from unexpected sources can play a big role. I can tell you that about 1/3 of DEP's needs were sourced and delivered by people or groups that wanted to help us. That saved us a lot of time. Work with the city, county, state, and other relevant agencies when practical. They all know people that you may not know, and their relationships can be valuable. Petition industry experts for feedback. It's refreshing how many people want to help despite their busy schedules. And meet with team members often, but keep the meeting short, and in this case, online. We were better able to stay on track by sticking to strict meeting start and stop times and having a set agenda that we didn't stray from. And finally, come up for air and get perspective. You can sometimes lose focus by being too focused. Let go of emotion and deal with facts. It's easy to get attached to causes, but practicality has to win out. So thanks for joining. We're open for questions and comments. Okay, as it is, I think we did a good job of explaining the process DEP went through to enter these new markets and what we did to network and collaborate and go from not having products to functional prototypes and also delivering products. DEP is very proud to say that just this week alone, we've delivered and donated over 1,000 face shields to the surrounding medical community. So thank you for joining today, and we wish you luck during this COVID crisis. Good day.